Welcome back. We've all felt the impact of the COVID-19 pandemic, from lockdowns to lost loved ones. But what if we could prevent such suffering from happening again? Bill Gates, the visionary behind Microsoft and a leading voice in global health, has a plan. In his gripping book, How to Prevent the Next Pandemic, he dives deep into the science behind infectious diseases and lays out a concrete roadmap to avert future catastrophic outbreaks. This book is not just for scientists and policymakers. It's for every individual who wants to understand the threat landscape and become part of the solution. Gates, with his signature clear and concise style, makes complex topics accessible and offers actionable steps for everyone, from staying informed to advocating for global preparedness. Did you know that experts predict another pandemic is not a matter of if, but when? So let's explore the plan of Bill Gates to prevent the next pandemic. Chapter 1 is A History of Pandemics. Gates begins by examining the historical context of pandemics, from the bubonic plague to the Spanish flu, highlighting the devastating impact of infectious diseases on human societies throughout history. He underscores the interconnected nature of our globalized world and the heightened risk of pandemics in the 21st century due to factors such as urbanization, deforestation, and climate change. Gates emphasizes the need for proactive measures to prevent future pandemics, drawing lessons from past outbreaks and the importance of preparedness, surveillance, and collaboration at the global level. Chapter 2 is Understanding Infectious Diseases. In this chapter, Gates explores the complex dynamics of infectious diseases, including their origins, transmission pathways, and impact on human health. He discusses the role of zoonotic diseases, which originate in animals and spill over to humans, in driving pandemics, citing examples such as HIV/AIDS, Ebola, and COVID-19. Gates emphasizes the importance of understanding the ecological, social, and environmental factors driving disease emergence and transmission in order to develop effective prevention strategies. Chapter 3 is Strengthening Health Systems. Preparedness is paramount in preventing pandemics, Gates argues. He highlights the importance of building resilient health systems capable of detecting, responding to, and containing outbreaks before they escalate into global crises. Gates discusses the need for increased investment in healthcare infrastructure, workforce training, and medical supplies, particularly in low and middle-income countries where health systems are often under-resourced and overstretched. Chapter 4 is Investing in Research and Development. Gates emphasizes the critical role of research and development in pandemic prevention. He discusses the need for sustained investment in vaccine development, antiviral drugs, diagnostic tools, and other medical interventions to combat emerging infectious diseases. Gates calls for greater collaboration between governments, philanthropic organizations, and the private sector to accelerate the discovery and delivery of innovative solutions to global health challenges. Chapter 5 is Harnessing Technology and Innovation. Innovations in technology have the potential to revolutionize pandemic prevention efforts, Gates asserts. He discusses the role of artificial intelligence, genomics, and digital surveillance tools in enhancing disease detection, tracking transmission patterns, and informing public health interventions. Gates calls for greater investment in research and development of innovative technologies for pandemic preparedness and response, including rapid diagnostic tests, mobile health applications, and telemedicine platforms. Chapter 6 is Addressing Root Causes. Gates emphasizes the importance of addressing the underlying root causes of pandemics, including poverty, inequality, and environmental degradation. He discusses the need for sustainable development initiatives aimed at improving access to healthcare, sanitation, and nutrition, particularly in vulnerable communities where infectious diseases are most prevalent. Gates calls for a holistic approach to pandemic prevention that addresses the social, economic, and environmental determinants of health. Chapter 7 is Promoting Global Collaboration. Global collaboration is essential in preventing pandemics, Gates argues. He highlights the importance of multilateral cooperation, information sharing, and resource mobilization in responding to global health threats. Gates calls for renewed commitment to international partnerships, such as the World Health Organization and the Global Fund, to strengthen pandemic preparedness and response efforts. He emphasizes the need for political leadership, financial investment, and public engagement to address the root causes of infectious diseases and build a more resilient global health system. Chapter 8 is The Path Forward. In the final chapter, Gates outlines a roadmap for preventing future pandemics. based on the principles of preparedness, innovation, and collaboration. He calls for sustained political leadership, financial investment, and public engagement to address the underlying drivers of infectious diseases and build a more resilient global health system. Gates concludes with a message of hope, emphasizing the collective responsibility of governments, organizations, and individuals in safeguarding the health and well-being of future generations. This book of Bill Gates got positive and mixed reviews from experts. Let's have a look on some notable reviews. Number 1. Dr. Tom Frieden, who's the former director of the Centers for Disease Control and Prevention, CDC, says that Gates' book provides a clear-eyed and compelling roadmap for strengthening global health security and preventing future pandemics. His proposals deserve serious consideration by policymakers around the world. Number 2. Dr. Margaret Chan, who is the former Director General of the World Health Organization, WHO, says that Gates offers a much-needed call to action for the international community to invest in pandemic preparedness. His book serves as a powerful reminder that we must learn from the past and work together to prevent future pandemics. Number 3. Dr. Devi Sridhar, who is the Professor of Global Public Health at the University of Edinburgh, says that Gates' book offers valuable insights, but it's important to remember that pandemics are complex events with multifaceted solutions. We must avoid oversimplifying the challenges and ensure that any proposed solutions are implemented with equity and justice in mind. In the end, let us tell you guys that Bill Gates and his foundation is contributing an important role in world health sector. Through the Bill and Melinda Gates Foundation, Gates has become one of the world's largest private donors to global health initiatives. The foundation has committed billions of dollars to fight diseases like malaria, HIV/AIDS, and polio, contributing to significant reductions in their prevalence and mortality rates. That was all for today. Share your experiences during COVID-19 and your views on this book, and don't forget to subscribe our channel. Thank you.